Hello, everyone. Welcome to Health Huddles. As you might remember, Health Huddles is a series dedicated to empowering those 50 and older in their health and wellness journeys, hosted by AARP Illinois. I'm very happy to be here. I'm Courtney Hederman, the Senior Associate State Director for AARP Illinois, and very excited to be joining with our very special guest on today's very important topic. It is very perfect timing to talk about all this. Now, just as a reminder too, AARP is the nation's largest nonprofit, nonpartisan organization. We advocate for what matters most to over 100 million Americans and their families: health security, financial stability, and personal fulfillment. In Illinois, AARP represents 1.7 million members and advocates on behalf of all those 50 plus. Now, our session today is in, of course, collaboration with the Illinois Department of Public Health. We love our Department of Public Health. And of course, the department aims to strengthen our community by providing insights to all sorts of things as it relates to our health. Now, today we're talking about vaccines, home tests, health resources on shingles, flu, COVID, RSV, so much. This is going to be packed. And I'm so very honored to be joined today. And it's really an honor and privilege to welcome Dr. Artie Barnes, Dr. Barnes. She's the medical director and chief medical officer for the Illinois Department of Public Health. And she is an expert on all these critical topics we're going to be talking. So welcome, Dr. Barnes.
Thank you. Honored to be here, and I want to say I'm grateful that we're talking about this right before the holidays. So I just want to appreciate everyone who's taking the time to listen in to.
Yeah, perfect timing, right? Thank you so much. Now, I encourage all of our virtual attendees to participate by asking questions. Like we've got a conversation ready to go here, but we want to hear from you as well and answer all those questions you have. So please share in the comment section, whether you're watching via Facebook or our YouTube channel, any comments or questions you might have for Dr. Barnes. She's here to address them and get all those questions answered. Now, again, I made reference to kind of what our topic is. It's really about vaccines, at-home testing, really available resources as we're hitting those winter months. And we know that we want, that we got a lot going on normally at this time. We're busy at the holidays, but we need to make sure everyone stays healthy, and we want you to manage your health as best as possible. So, all right, let's just dive right into questions. Okay, so as we age, Dr. Barnes, we have a lot of conversation about the flu, and really the flu is way more than a seasonal kind of nuisance, especially for those that are over 50. So, people certainly take a flu vaccine to help, but can you talk a little bit about the flu and why it kind of affects more of those that are the 50 plus?
Yeah, so unfortunately, while we've been so distracted by the more pressing concerns with COVID, flu hasn't really left us. And 70 to 80% of seniors are the ones who end up in the hospital with, of all those who end up in the flu, most of them are seniors, I would say, or are older adults. And I think it's really important to figure out what it is that protects them. And the one thing we know time and time again that makes a difference between ending up in the hospital with flu versus not is the vaccine. And timely treatment can help, but with flu, it's a very narrow window. You got to get that treatment within 48 hours, just 2 days from when you start getting sick. So it's not a lot of time to even figure out what's going on. Oh, I have a flu. Call your provider, get the Tamiflu or some other prescription. So the vaccines are really your best shot of protecting it. And I see a question in the chat too, but it's too late to get the shot. It is not. So we really want to get the flu shot. It starts all the way in August, September, and that's mostly for pregnant people so that they can protect their babies who are born during flu season, but and people who are very severely immunosuppressed, like they have very weakened immune systems, maybe they're on chemotherapy, but we really want people to get their shots before flu season peaks. It peaks often in December, mid to late December is when it peaks. And the shot takes about 2 weeks to really build immunity. So if you get your shot today, sometimes people say, oh, I got the shot and then I got the flu right after. it doesn't really work super fast. So it takes about 2 weeks to build that strong immunity. So no, it's not too late to get the flu shot. Usually flu season ends in April. Sometimes we have a longer lingering flu season and ends in May. So till the end of flu season, you should be able to go ahead and get the flu shot each year. So
Yep, makes sense. That's fantastic. Well, you made reference though that, sometimes you need to have fast treatment, like 48 hours, right? And so, sometimes I think people kind of put off going to the doctor because they're like, oh, I've got an upper respiratory, or, I'm it's not really the flu, but it is the flu. So maybe can you talk a little bit about the signs of the flu?
yes, so fever is often a big sign of it. The older and more frail we get, any infection can, make us confused too. So in our older adults, it could just be a little bit of fever, fatigue, confusion. You already might be having lung and heart problems and might have difficulty breathing at baseline. So you might just notice that getting worse, and you might not know, okay, is this my COPD? Is this my heart disease? But again, if it's in the season, you're starting to have a fever, cough. Sometimes you can get a little bit of a cold too, like nasal congestion we call it. But mostly it's going to be fever, cough, sometimes sore throat, and a
Mhm.
lot of again fatigue that people experience, which is just a way of saying difficulty breathing. So if you notice that, don't wait, go get checked out as soon as
Mhm.
you can. And one important thing to know that a, a lot of people, older adults who get flu, also end up having heart issues,
Hmm.
heart attacks after the flu, because the virus can irritate the heart. And so it's not just your regular pneumonia that you have to worry about, but it's also what is the impact of getting flu on your heart. So getting the vaccine has shown right now that it'll actually reduce your risks of getting heart attacks and dying from heart disease after the flu, as well as strokes. So there's literally a 12% lower chance of having a stroke after the flu once you get the flu shot. So there are benefits to the flu shot beyond just protecting you from getting
Mhm.
really bad pneumonia, flu-related pneumonia that lands you in the hospital.
Yeah, wow, wow. That is fantastic information. Now, we know that we also have to worry about RSV. I think a lot of people think of RSV more for infants and babies, but RSV can obviously hit anybody at any age, and particularly for older adults, it can be quite serious. But we have obviously the flu and RSV. So can you share a little bit about what the difference of those two are, and what signs and kind of symptoms to look for? Like, hey, wait, I think it's the flu, or I think it's RSV, and I should really go and go into the doctor and get checked out.
Yeah, and the one thing to know, it's not an exact science because every human being responds differently, is that mostly flu, RSV, COVID, they hit you hard and fast compared to
Hmm.
say most of the other viruses where you get a cold, the cold lingers, then it gets
Yeah.
a little worse and it slowly progresses. So if something's hitting you hard and fast, think about COVID, flu, or RSV as causing it. The symptoms and signs are fairly the same. Going to get a cough, you're going to get fever. Sometimes the fever is subtle, you may not realize you have it, and difficulty breathing, you may have sore throat, even chest pain, things like that.
Hmm.
But the RSV has been around for a long time. It's just that we finally now have the tools to protect people from it. We don't yet have treatment. And why you think of RSV as something that really impacts babies, you're right. It does impact babies, but it really kills our older adults. So it's the babies who get infected from it. It's their grandparents who end up in the hospital and not making it out of the hospital from it. So it's something really important to know that it's the highest mortality or death rate from RSV is actually in our older adults.
Hmm.
Though the burden of the infections is all mostly in the younger children. And so finally, we do now have an RSV vaccine for those who are 60 years old and up. And
Hmm.
so it's important this vaccine works. It works not just over the first RSV season, but into the second, a little bit into the second one too. And it's 80, 70, 80% protective from severe
Hmm.
illness. So that means from ending up with really bad pneumonia related to RSV and really bad hospitalizations or illness that puts you in the hospital, or even, unfortunately causes death too. So the vaccines are designed to protect you from severe illness more than they don't prevent infections. That's not how they
Mhm.
work. They work when your body sees the infections and is able to attack that infection.
Yeah.
It reminds your bodies how to launch that fight. So they're designed to really prevent severe disease. And I think that's what I hear a lot. People say that, well, I still got the infection after I got the
Yes.
shot. And the reminder is, well, did you actually end up in the hospital? If you did,
Right.
the vaccine did its job.
Right.
So it's just an important reminder about what the vaccines are really designed to do.
That's a great explanation. I appreciate you sharing all of that because I agree. I think people do, they just really think like, oh, just because I took the vaccine, I'll never get it. But it's really more about having it, and then you're able to fight off if you are positive for any of those things, and you just do better, right? Do
Yes.
better than you would have if otherwise. Okay, so you've talked about the vaccines of like flu, COVID, RSV, but let's talk a little bit about the timing, right? Like, so timing, you talked a little bit about the timing, like there's never necessarily a wrong time, like it's not too late to take the flu, but can people take all three of those vaccines at the same time? Like, can you talk a little bit more about the timing of those three specifically, flu, COVID, RSV?
Yes, absolutely. So you could, flu is, of course, during flu season. It's usually available August, September, but we recommend that people get it ideally uh, before December, before the peak of flu season. For
Mhm.
RSV, the season actually starts a little earlier. October to March is when what we call
Okay.
RSV season. And so for the RSV vaccine for pregnant people, that is actually, they say, start a little early. September to January is when they're recommending pregnant people get vaccine. But our older adults, if they're not pregnant, again, would be in the classic October to March season for getting the vaccine. And
Gotcha.
COVID, of course, they haven't put a seasonality to COVID. We're still
Mhm.
predicting it, but we usually have a deep winter, December, January peak. We've had that for the past 3 years. So again, just common sense. Best time to get a vaccine is right before these infections start peaking and not just get so rampant in the community that you might just make a small trip to the grocery store or take the train and or the bus and be exposed to it. So
Mhm.
before it gets to that state where it's so common in the community, make sure you protect yourself. So I would say November, December is a good time to get these vaccines. However, just remember, and of course, October for RSV,
Mhm.
you can, in theory, take all three at the same time. If if you feel you want to
Mhm.
pace them out, some people are more sensitive to reactions from the vaccine, compared to others. If you want to pace
Right.
them out, then you can pace them out by a week.
Mhm.
Ideally not by a month, because then you're a little too late. By then, you're halfway into these respiratory seasons. But you can pace them out a little bit. There's no minimum time between vaccines. It's not like, oh, if you got the shot, the flu shot today, you cannot get the RSV shot for another like 6 weeks or something. There's no
Mhm.
minimum time interval between them. If you want to just go it all at once and get all three at once, you can do it. I got my flu and COVID shot at the same time
Mhm.
this season.
I did too. Mhm.
I had a sore arm from the COVID for a day, and after that,
Yeah.
it was fine. I didn't have any other side effects. So that's a reassuring. Hopefully, most people will also not have a very hard time with the after effects of the
Mhm.
vaccines if they get them all
Sure.
at the same time.
Sure, that makes sense. Yeah, okay, so we have actually some questions that are coming in. So just want to share those. So someone is asking, are there any conditions that might make RSV worse, like asthma, for example?
It's so those who are at risk for the RSV vaccine, for getting complications from
Mhm.
RSV, are the ones who have a lot of underlying medical conditions. It's not just asthma or lung conditions. COPD, heart
Mhm.
disease puts you at risk. Even having frailty, living in a long-term care facility means that you have conditions that will put you at risk. So all
Hmm.
these populations, people who have kidney and liver problems, diabetes, all of these conditions put you at risk for RSV. And when I was talking to some residents of a senior living facility, they said, "Yeah, I went to my doctor or provider, and they said that I didn't need the shot." And I was thinking to myself, well, if you have kidney problems or liver problems or heart problems or lung problems, which is or diabetes, which is pretty
Yeah.
much most of us, you would be at risk. And then at least it's worth having that discussion with your provider, saying, is this time for me to get this vaccine?
Right. No, that makes sense. Yep. No, that's great. So another question that came in, this actually relates as COVID and the COVID testing particularly though. So like, does the home test for COVID-19 detect the most recent strain of
Yes.
COVID? Yeah, because they're the ones that are on the shelves, as this person even said, like, I heard that ones we got off the shelves now don't detect. So what's the most recent strains and how do we test for those?
Yeah, so there are multiple recent strains now. In the
Right.
past few waves, we would get one strain that would like burn through the entire population and dominated 80-90% at a time during these waves, the Omicron, Delta, all of that.
Yep.
Now they're all fighting for supremacy. So maybe 25-30% prevalent, each of them, EG5, BA 2.86, all of these. So the good news is the NIH monitors the tests, and when there are tests that no longer work against the current strains, they will send out a notification. And right now, the good news is these tests work. However, one important thing is, because people are testing at home,
Hmm.
they test early, and it's not yet time. It's sometimes too soon for the test to turn positive. So the
Hmm.
recommendations are, it's not that it's negative once and you're done. You actually have to retest 48 hours later, at least 1 day to 2 days later. And usually that second test is the one that'll turn positive.
And that's like after you're experiencing
Correct.
experiencing symptoms, 48 hours, make sure you're testing again. And then is it ever too late to, do they expire? Do these tests expire? We're like, this
The
is definitely
tests,
not going to
well,
detect.
yes, the tests expire. Most of them have about a year's shelf life.
Hmm.
And so if people who've used old tests that they've had from
Right.
last season that they never bothered with, they may not be that reliable anymore. So
Gotcha.
don't use the old test. Look at the expiration date, because they have liquids in them, and those liquids don't last, as long.
Sure.
And another important thing to know about the tests, you can still get free tests through, if you go to covid.gov, you can still get the 4 free tests this season too. So take advantage of that.
Yeah, absolutely. Yeah. Well, so let's just stay in COVID for just one more minute or so. So if in fact someone does test positive, when do you suggest they kind of, they call their, healthcare professional, their doctor, and, like, do they necessarily need medication? How do you know? And is there any other guidance right now for COVID-19? Because I feel like we've had a little bit of an uptick recently. So any new guidance too you'd want to share?
Yes, we do have an uptick. There are at least 10 counties in Illinois that are now at what we call in high community COVID
Mhm.
admission levels. That means people in those counties should be masking. There are about 40 counties that have gone from low to medium. So COVID is really hitting
Here we
that
go again.
winter wave right now. And people should be masking. People should be masking around others who are vulnerable, so that if they have something, they don't spread it to their loved ones, especially because it's holiday season. And I know it's hard, but unfortunately, this is a powerful tool to protect yourself. It's important to remember that there is a way to have well ventilated spaces even in the winter.
Mhm.
Find out if your HVAC system, if you live in a congregate facility, check with your
Mhm.
building management on their HVAC system. How often are they circulating the air through central air systems? If not, put portable HEPA filters in your
Mhm.
rooms, especially if it's going to be a holiday dinner and a lot of people are going to be unmasked, talking loudly, eating and touching a lot of things. Now, we can't help with touch, but
Mhm.
at least the portable HEPA filters will clear out the viruses faster from the room.
Mhm.
Remember, please wash your hands. If you're in a buffet style dinner for the holidays, make sure before you're touching things that several other people have touched. Before and after, just make sure you have a little bit of pocket hand sanitizer, just hand sanitize your hands. Those small things will help minimize your risk. The treatment now. So you have 5 days for the oral treatments. So if you start having symptoms or test positive, but sometimes you might be asymptomatic, you should talk to your provider immediately. Now, to qualify for treatment, you really have to have mild symptoms. But again, fatigue, when people just can't breathe and are just getting so tired, just a small, even a mild symptom is appropriate. Don't wait till it's too severe.
Right.
By the time you need oxygen, it's a little too late for these oral antivirals that we use on the outpatient side to work to stop that hospitalization. And then you need to be in the hospital and get IV and other kinds of medications for COVID. So the two oral antivirals, Paxlovid, Lagevrio, you have 5 days to tap into it and tap into your provider, make sure they've run the drug interactions, and that you can take one or the other of the two antivirals. Now, there are two. Sometimes it's hard to get hold of a provider. People are on vacation. It's the holiday season. So IDPH has two. IDPH has one sponsored service through the SIU School of Medicine. It's telehealth. It's open access for anyone in Illinois. It shouldn't be any cost sharing for you. So if you call those lines, we've made that information available also on our website. But I can also send you, Courtney, some of this information to send to your members after. Just call that if you cannot get hold of your doctor, and they can decide if you need a prescription and send it to your local pharmacy. Now, if you have insurance, both these, there's also the NIH test to treat. It doesn't matter if you have insurance or not. The NIH test to treat, you just go to test2treat.org, and you can say, hey, I just tested positive for COVID, or I want tests, and they'll send you both COVID and flu tests. And then if you turn positive, you call them immediately, and they'll get you, they'll see a provider, and they'll send you the medications, no cost to you, it's totally free. And also just remember that 2 antivirals are now commercial. So insurance does kick in now, but the free U.S. government supply that was provided to all our residents, that is really dedicated for those with Medicare, Medicaid, and are uninsured, and even in some cases underinsured. So most of our older adults, I hope, have Medicare, and those free U.S. supply doses should be for you. For whatever reason, if they cannot tap in, just remember both Lagevrio and Pfizer, Merck for Lagevrio and Pfizer for Paxlovid have patient assistance programs that can reduce the cost completely for both these products. And we just sent out another notice on that yesterday. So again, I'll share that just so that if you're empowered as what your options are, then you're not struggling with, maybe your provider hasn't had a chance to catch up on this information yet, or maybe the pharmacy hasn't had a chance to catch up on this information. So that there are patient assistance programs through which you can get these medications, ideally fully for free.
Awesome. This is fantastic information. Oh my gosh, this is wonderful. Okay, so let's just switch topics just a bit, but still staying in the same vein as vaccines, but let's talk about shingles. And I know because we've been concentrating on flu and COVID, RSV, very pertinent to right now, but shingles also can affect us at any point, right? Especially for those 50 plus. So can you talk a little bit about shingles, kind of why does it occur? And maybe, obviously there's a vaccine for shingles. So let's talk about, how about that vaccine too?
Yes. So shingles, we've all had chicken pox, hopefully either the shot or the infection itself as a child, right? So chicken pox is the varicella virus. It enters our bodies. It goes into hiding, like in a sleeper state in our nerves. And when our body is under stress, as we get older and as our body ages and it's not able to fight things the same way it does anymore, it reactivates. And that's when you get a shingles outbreak. So remember, the shingles is still from that old chicken pox you had when you were 12 years old, but it reactivates. But it doesn't look like chicken pox when it
Right.
activates unless you really have a very weakened immune system. It just, maybe will be like most often people get a little band right around their trunk, of small little blisters that can be really painful. Now, remember,
Right.
because this virus hides and sits in the nerves and then irritates the nerves, it can be extremely painful. And we call that post-herpetic neuralgia, or pain in the nerves. And so it's going to be very important to make sure that you are protected, not just from getting a shingles outbreak, but also getting this vaccine protects you from getting post-herpetic neuralgia, that pain that can linger even after the outbreak is quietened down.
Hmm.
So for people, even regardless, even if you had chickenpox as a child, you get the shingles vaccine. It's
Okay.
now an inactivated, it's not a live vaccine, and you get it's 2 shots. They separate it out by
Hmm.
you get the first shot, and the second shot is 2 to 6 months later. You really have to make sure that you get it above the age of 50. All right, it's just one time. It lasts for at least 7 years. This
Hmm.
is pretty potent effect. It's almost, I think, over 90% protective from getting a shingles outbreak and from preventing what they call post-herpetic neuralgia, that pain in the
Painful.
nerves that occurs
Hmm.
after. Um, if you had chicken pox as a child, you get it. If you have even the vaccine, if you had the chicken pox vaccine earlier, you should still get the shingles
Hmm.
shot. So um, again, everyone over the age of 50.
So do you need, like, what if you never had chicken pox? Do you still need to get it?
Then most people will get first the chickenpox vaccine, and then
Gotcha.
after the chickenpox vaccine, you get the shingles vaccine.
Gotcha. Gotcha. And then, okay, so if it only lasts like 7-ish years, do you need to do the shingles vaccine more than one time?
Right now, there's no recommendation to repeat
Okay.
it again, like in every 10 years. But one thing that a lot of our older adults do not get is the Tdap, the tetanus pertussis vaccine. That is
Yes.
every 10 years. So
Every
every
10 years, everybody. Yep.
10 years. So we just recently had, um, uh, an older adult who really it boiled down to where we thought she got tetanus, which is very unusual.
Yeah.
But she hadn't received her vaccine in a long time, so she was still vulnerable. So we forget. Now this vaccine again is protects you from tetanus, pertussis, which is whooping cough.
Right.
Yeah, and so it also is, and diphtheria. We don't see diphtheria anymore, but hopefully we never will. But again, it protects you from some really powerful infections that are circulating right now.
Okay. So, all right. So every 10 years is the tetanus. Get your shingles, get your, that's like after, over the age of 50, hopefully
Yes.
maybe just one time. Then you got flu, COVID, and RSV,
RSV.
basically like annually almost. I
Yes.
mean,
And
that's,
pneumonia. Do
and
not forget
pneumonia.
the
Oh my
pneumonia
gosh, let's talk about that. Don't
shot.
forget
Yes.
about that.
Yeah. And the pneumonia shot is a little tricky right now because they've updated the guidance. They have a new shot that came out recently. And so it's
Mhm.
important to check with your provider whether and when you need this new shot. Depends on
Mhm.
the number of shots you had before for pneumonia and
Sure.
the type of shots, whether you had the 13 valent or 23 valent. So it's a little more complicated, but you just have to check. It's like, hey, is it time for my pneumonia shot?
Gotcha. Gotcha. That's really helpful. So are there do you think there's other vaccines on the horizon for other conditions or chronic illnesses, do you think?
There are vaccines that are coming out in general, but one thing that I just want to flag more than the future vaccines, our older adults, especially in the US, love to travel and they love to get on their, international trips, and it's a beautiful thing. And one thing I want to strongly recommend: you go to the travel clinic and make sure you get all the shots before you go to these places, because there are shots that you would not get in the US that are not recommended. It could, unfortunately, during COVID, some of those shots were not even manufactured
Mm-hmm.
during that time. But shots to protect you from typhoid, shots to protect you from,
Mm-hmm.
again, make sure like you're up to date on your polio vaccine,
Mm-hmm.
before you go to areas that are circulating with polio. So it's going to be malaria. There's a malaria vaccine now, but the vaccine is for really children who live in countries with malaria. But there are pills that you can take to protect you from getting malaria while you travel. So it's going to be just important to just don't forget to get your travel shots before you go.
Oh, this is all wonderful, wonderful advice. I can't believe this, but we are at our 30 minutes already. This has gone so fast, and this has been wonderful information. Thank you so very much. Our thanks to Dr. Artie Barnes, the medical director and chief medical officer at the Illinois Department of Public Health. You are an expert and really just gave so many people so much wonderful advice, especially at, I think, this winter months where we sometimes tend to get a little sick and get exposed to some tough stuff like flu and RSV and COVID. So anyway, thank you so very much, Dr. Barnes. Appreciate you. Now, to everyone watching, AARP Illinois is committed to strengthening communities and advocating for the crucial pillars of health security, financial stability, and personal fulfillment for you, your family, and for all those 50 plus. We thank you for joining us today. For more information, please visit aarp.org/Illinois. AARP Illinois is here to support you. We look forward to connecting with you for our upcoming events. So check out, again, aarp.org/Illinois so you can get all our upcoming events. Stay informed, stay healthy, everyone. Stay empowered and stay, of course, connected to AARP. This concludes our virtual event, and be well. Thanks so much.